Dr. K, live.
We are live now, sir. Please go ahead.
Thank you. Namaskar, good afternoon, and welcome once again to another edition of webinars in the series Illness to Wellness, organized by ASSOCHAM. And the topic today is a very actual and a very, very important topic, that is Omicron risk and prevention. And to enlighten us on this topic, we have one of the most famous and important and knowledgeable faculties from different hospitals in Delhi who are going to answer our questions and who are going to clear our doubts. And I think this is going to be a very interesting session and a very useful and a very informative session, because there's so many doubts, there's so many questions, there's so many apprehensions about the current I would say the sweeping wave of COVID, and if it is Omicron or not Omicron. We're going to discuss all this in coming 1 hour. So thank you to all of you for joining, and thanks again to the faculty for being with us. Now I would request Sri Anil Rajput ji to start the webinar with a few words of introduction. Sir. Shri Anil Rajput ji is the chairman of the CSR committee of ASSOCHAM, and he's been guiding us since past many years organizing these webinars, and before that there have been a number of illness to wellness program has conducted hundreds and hundreds of camps in which physically patients and participants from different parts of the city, Delhi, were checked, were monitored, and number of tests were done. They were guided about their health and diabetes. And I would once again like to thank Shri Anil Rajputji for organizing this wonderful chain of events, and over to him once again. Sir.
Thank you, Dr. Kesri, for such a elaborate and flattering introduction. I don't deserve all this, but I'll take it coming from you. It's my proud privilege today to welcome Dr. Ravi Shankar Jha, Additional Director and HOD, Department of Pulmonology and Sleep Medicine, Fortis Escorts Hospital, Faridabad. Dr. Reshma Tiwari, Chief Critical Care in ICU, Artemis Hospital, Gurugram. Dr. Kavita Tyagi, Consultant, Department of Cardiology, Sir Gangaram Hospital, Delhi. And of course, Dr. Rajesh Kesri, Founder and Director of Total Care Control, Delhi, NCR. Good afternoon to all the participants who joined us today, and a very happy new year to all of you. The new year has dawned on relatively worrying circumstances, with the COVID-19 strain Omicron unleashing its fury in India and ravaging several nations across the world, dashing our hopes that the end of the pandemic might be in sight. The World Health Organization has warned that Omicron has a growth advantage over the Delta variant, with doubling time of 2 to 3 days, and that the rapid growth rate is likely to be a combination of both immune evasion and intrinsic increased transmissibility of the variant. In India, the Omicron variant has become the predominant circulating strain, resulting in an exponential rise in infections. According to the Union Health Ministry data, the total number of infections of this new variant currently stands at 4033. The country has reported over 1.7 lakh fresh COVID cases, with a daily positivity rate of 13.29 as on 10th of January 2022. The country's R naught value that indicates the spread of infection also stood at 4 last week, aggregating a very high transmission rate, which is higher than the 1.69 recorded during the peak of pandemic's second wave. Moreover, major cities, the Omicron variant is accounting for more than 50% of fresh cases of infections and a massive surge in the number of cases over the last 1 week is indicative of third wave of the pandemic as is being witnessed in several countries. Though it is still early for a definite verdict on Omicron, which is apparently more contagious than its predecessors but less deadly, we are being continuously warned to not be lulled by this narrative, as this may be equally fatal, especially for those not vaccinated or have comorbidities. While many nations have a much higher rate of vaccinations, including booster shots, to help ward off the worst of this wave, India has fully vaccinated only 66% of adult population and has just started inoculating children between 15 and 18 years. We have a higher number of people with underlying diseases, and booster doses have only started yesterday for people above 60 years old. All these are worrisome factors as India faces its Omicron wave. Therefore, anything we can do to accelerate our vaccination rate will go a long way in blunting the impact of the new variant and variants to come. We've also suffered tens of thousands of deaths and about 4 lakh new infections per day at the peak of the second Delta variant driven wave last year. That wave overwhelmed the country's healthcare system with hospital beds, medicine, oxygen supplies, all running desperately short. Amid the rising cases of Omicron infections in the country, health experts have indicated that even if Omicron does cause less severe disease, the sheer number of cases would once again overwhelm unprepared health system. Hence, it is imperative to ensure that healthcare infrastructure is well prepared to deal with this sudden rise of this infectious disease. With the new wave of fear rising in the country, several restrictions are being imposed to prevent the transmission of the virus. Government health authorities are emphasizing that vaccine alone is not sufficient to contain this pandemic, and responsible behavior is the way forward, which includes wearing a well fitted mask, physical distancing, hand hygiene, ventilation of indoor spaces, and above all, no crowding. Unnecessary travel must be also avoided at any cost. There needs to be a constant vigil and good old containment and surveillance strategy will remain fundamental to pandemic control. The COVID-19 pandemic is putting new and unforeseen pressures on all of us. New variants like Omicron are a reminder that the COVID-19 pandemic is far from over. While there is research every day on Omicron, people have many questions about this surge. Its transmissibility, on how well vaccines and prior infections protect against infection, how virulent this variant is compared to other variants, the control measures that can be taken, and so on and so forth. Therefore, under these circumstances, today's webinar, Omicron Risks and Preventions, organized by ASSOCHAM under its Illness to Wellness campaign, holds great importance. We are joined by eminent personalities who have deep knowledge and a keen understanding on this subject at hand. I once again welcome them and look forward to an enriching conversation. And I am greatly thankful to all of them for sparing their valuable time and coming and sharing their thoughts with us. Thank you very much. And over to you, Dr. Kesri, for taking the proceedings further.
Thank you so much, sir. Thank you so much for the nice and elaborate introduction and for the setting of the stage for us to carry on a very, very interesting and a valuable discussion forward, sir. So in fact, we have so many questions that are pouring in, and I personally also want to ask our specialists, our eminent panelists questions. We have little time, so we would right away start with our discussion, as the introduction of our panelists has already been done by Shri Anil Rajputji. So I would like to come to Dr. Ravi Shekhar. So, first of all, carrying on the same discussion that was initiated by Rajput sir, that even though it seems that this variant is not that lethal, it is not that dangerous. What is your opinion? What are you seeing in your hospital? You're a pulmonologist. Are beds already being occupied by COVID patients? What is the future? How do you see from here on what's going to happen?
First of all, very good afternoon to all of you. And now that our country is getting into the third wave of COVID, what I'm witnessing for last few weeks is that initially we used to see only milder kind of patient, but over the period of past 3-4 days, the number of cases have started increasing tremendously. And now for past 2 days, I have seen around 4-5 sicker patients who developed hypoxia, who developed low oxygen level, who develop higher respiratory rate, that is called tachypnea. I mean, I had seen few patients in actual respiratory distress. It is, I mean, we have not done the genome sequencing on them yet, but then it is quite possible that initially we'll see a very high number of milder cases, but then if we do not take the proper kind of COVID appropriate behavior and approach, then it is like, likelihood the virus may mutate to a more dangerous form in future.
Thank you so much. Dr. Kavita, what is your opinion? Even though we are already seeing, as Dr. Ravi is mentioning, that he is having patients with respiratory distress, अगर सरल भाषा में कहें तो ऐसे मरीज आने लगे हैं जिनको सांस लेने में तकलीफ हो रही है. हालांकि हम अभी तक सुनते आए हैं कि ओमिक्रॉन का जो वेरिएंट है इसमें सांस लेने में दिक्कत नहीं होती. तो यू बीइंग अ कार्डियोलॉजिस्ट, व्हाट डू यू फील एंड व्हाट डू यू सी कि जो अभी कोविड के जो पेशेंट हैं, एवं तो हमें नहीं पता कौन सा पेशेंट कोविड ओमिक्रॉन वेरिएंट का है, कौन सा पेशेंट डेल्टा का है, कि इन पेशेंट्स को कार्डियक प्रॉब्लम भी हो सकती हैं, हो रही हैं क्या? आप इसके बारे में क्या बताएंगे? व्हाट वुड यू लाइक टू से अबाउट दिस?
हाँ जी, thank you so much. So I think as Dr. Ravi Shankar said, even we at Gangaram are noticing almost the same kind of trend. Initially, so many staffers and so many patients from outside, they were positive, but they were mildly symptomatic. At the most, moderate symptoms were there. But the patients who are having already comorbidities, like the patients who are having already LV dysfunction, like poor heart pumping, people who are having already diabetes, hypertension, obesity, COPD, they are not taking this infection really well. They are getting into serious illness. That is what we are also noticing. And cardiomyopathy also we are seeing tachycardias, bradycardias, we are noticing. And so in this scenario, I think what the factor will make a difference is the comorbidities, obviously the baseline condition of heart and lungs, and other issues. They will certainly have impact on how Omicron is going to behave with majority of the people.
थैंक यू डॉक्टर कविता। जैसे डॉक्टर कविता ने बताया कि ऑलरेडी जिन लोगों को दिल की बीमारियां हैं, हृदय रोग हैं, डायबिटीज़ है, चेस्ट की बीमारियां हैं, ऐसे लोगों को सीरियस प्रॉब्लम हो सकती हैं कोविड इन्फेक्शन से। सो यू ऑल हैव टू बी केयरफुल एंड दिस ऑलरेडी इज बीइंग सीन इन हॉस्पिटल्स। Coming over to you, Dr. Ishma, what is the trend in your hospital? What are you noticing?
Well, I have a slightly different experience till today, but it's been only 10 to 15 days since the problem has started. But I think here in Gurgaon, in Haryana, possibly because it was a district that had been declared fully vaccinated some time back as the first in India, we have not seen such neither large numbers requiring admission so far. And we have also not seen patients who have really true respiratory diagnosis happening while they are having COVID. And the larger number of patients admitted with us with COVID are actually those admitted with their other comorbidities. For example, a chronic kidney disease and found to be COVID positive because he came with a little breathlessness, but after dialysis has settled down immediately. So I think most of our patients are actually admitted with their comorbidities rather than COVID per se causing the problem. And but I think it has been only a few days, so we might see this changing as the numbers go up. So far, the numbers are also not alarming to us, but I think we are prepared and expecting it to change exponentially.
Thank you so much, Dr. Kavita. So, yes, people who already have diseases like kidney diseases and lung diseases, asthma, they should be very careful, and probably they are the ones who are reporting to hospitals and getting admitted. I'd like to come to you, Dr. Ravi, if you're there. Tell us about the symptoms of Omicron. Obviously you are seeing patients with COVID, but are you seeing some different symptoms, something different from what you saw during the last waves? And would you please elaborate on that?
So
Can speak in a mixed language in Hindi as well, because
right. So there are few symptoms which are very, very typical of Omicron. I mean, that we had not seen in last Delta wave and Delta plus variant. One of the commonest symptoms that we are noticing is a lot of patient present with backache. मतलब कई सारे patient आपको इस तरह की history लेके आते हैं, ऐसा the emergency guy feel that they have some kind of ureteric stone or something. Unilateral backache is reasonably common in this variant. Plus headache is very, very common in this variant. Loss of taste and loss of smell, we are yet to see in any of the patient of Omicron variant. Fever, mostly Omicron variant में what we are seeing is कि 101, 102 के around चलता है. It doesn't go beyond 103 type जैसे कि traditional में मिलता था. Plus lot of post nasal drip is there. Like जो आपके पास मरीज आते हैं वो लगातार अपना गला इस तरह से साफ करते हुए मिलते हैं. That is a sign of significant post nasal drip. Another important difference कि जो हमें ट्रेडिशनल डेल्टा वेरिएंट में मिलता था उसके अंदर पेशेंट यूज्ड टू हैव अ लॉट ऑफ ड्राई कफ, सूखी खांसी होती थी, पर इस वाले वेरिएंट में पेशेंट्स को कई बार खांसी के साथ काफी अच्छे खासे अमाउंट में बलगम आता है. ये जो बलगम आना खांसी के साथ अगेन इज अ फीचर ऑफ ओमाइक्रॉन वेरिएंट rather than ट्रेडिशनल डेल्टा वेरिएंट.
So, what I'm noticing as a cardiologist, along with the symptoms which Dr. Ravi mentioned very elaborately, we are seeing all the symptoms, almost same kind of pattern symptoms we are seeing. Along with that, what I'm noticing is that fluctuations in blood pressure and fluctuations in heart rate also I'm noticing. And the people who are diabetic, they are getting their sugar, maybe would be that stress factor. But these two things are also being noticing slightly more than what other populations.
Are you noticing any GI symptoms also, like those were in the Delta variants. Have you noticed in any of your patients कि पेट की कोई प्रॉब्लम हो, पेट में दर्द हो रहा हो या ऐसी कुछ प्रॉब्लम?
Patient do present with unilateral backache like renal stone type of problem. Pain abdomen is although reasonably common, पर वो last वाले variant में भी हमें काफी मिलता था. Then
जी.
loose stool also is a common finding, but that was also seen. That's kind of feature of all viral infections. So last वाले variant में pain, loose stool was reasonably common. The
Yeah.
only difference as far as GI symptom are concerned that I can see कि इसमें renal area में pain काफी अच्छे खासे number of patient में मिलता है, plus headache is very very common in this variant.
Definitely true. I think so many patients that we are all seeing, and all of them are coming with complaints of severe body ache, backache, and headache, and obviously throat complaints and cough and sputum. So, Dr. Saab, any one of you can contribute. ऐसा कुछ टाइमलाइन देखने में आ रहा है कि पहले ये प्रॉब्लम होती है, फिर आगे कैसे प्रोग्रेस करता है? No, the reason why I'm asking is कि this is the time when there are a lot of allergies, otherwise seasonal flu भी होता है. तो दिक्कत क्या होती है कि ज़्यादातर लोग ये सोचते हैं कि अभी तो हमें सर्दी जुकाम है, बिकॉज इस टाइम में तो सभी को हमेशा ही होता है. अभी ठंडी हवा चल रही है, अभी बारिश हो रही है, तुमने खिड़की खोली छोड़ दी, तुम बाहर चले गए, इसीलिए आपको हो गया, तो आपको कोविड हो नहीं सकता. आई मीन, इज देयर सम वे दैट पीपल कैन डिफरेंशिएट, और व्हाट शुड बी द आइडियल अप्रोच ऑफ अ पर्सन हु डेवलप्स दीज सिम्टम्स? क्या करना चाहिए एक्चुअली?
So I think one thing is very common कि जो जैसे हमें लगता है कि बारिश का मौसम है, खांसी हो गई या जुकाम लग गया, मोस्टली इट इज कॉमन इन पीपल हु हैव हिस्ट्री ऑफ एलर्जी. नाउ जिनको एलर्जी की हिस्ट्री नहीं है पहले से, या अस्थमा नहीं है, राइनाइटिस नहीं है, इफ दे आर प्रेजेंटिंग टू अस विद एनी कफ और कोल्ड, दैट मीन्स इट इज नॉट सीजनल, इट इज वायरल इन्फेक्शन. वायरल इन्फेक्शन अभी फ्लू उतना कॉमन नहीं है. फ्लू इज मोस्टली सीन इन द मंथ ऑफ मार्च एंड देन अक्टूबर. So इस समय any patient who presenting with any viral kind of illness, first definition should be COVID only. So mostly जो मेरे patient fresh history लेके आते हैं cough cold के, even if they don't have any fever or chest, I advise them to undergo rapid antigen then RT-PCR testing if RAT is negative, and that is the best way to isolate. Although अब आज के टाइम पे ऐसा लग रहा है कि जो रूटीन में स्क्रीनिंग कर रहे हैं इमरजेंसी के पेशेंट, उसके अंदर भी रैट पॉजिटिविटी काफ़ी हाई है. सो देर इज नथिंग, नो सिम्टम दैट इज वेरी वेरी करेक्टरिस्टिक कि अगर ये हुआ तो हम पेशेंट को कोविड ही कह सकते हैं. सो एनी पेशेंट नाउअडेज हु इज प्रेजेंटिंग विद कफ कोल्ड इवन इफ नो फीवर शुड बी टेस्टेड फॉर कोविड.
Thank you so much. Yes,
Yeah.
ma'am, please.
I noticed is maybe Ravi can contribute to me that the symptom onset is quite abrupt. Like a person will keep on feeling a little cold, obviously will not be able to differentiate from the cold otherwise prevalent. But patient will start having the fever, the headache, the backache, and all of a sudden, which will not be explained by our so-called the common cold symptoms. That is what I distinctly saw the difference. However, the mild patients, they have a distinct sore throat, like the dry cough, the nagging cough all the times. That is more common in comparison to the common cold. Is what I noticed, at least in my patients.
I think
Yes.
I think
Yes.
I have very much had patients telling you that they do have GI symptoms. Initially it is a runny nose and some sore throat, fever. The body ache, I think myalgias have been perhaps even more than in the Delta variant when we had the second wave. Though the person is still mild disease because he's not having any issues with saturation, etc. But the myalgia has been quite severe, and that rapidly settles in a day or 2 days. For 1 or 2 days, it is very severe and then rapidly settles. That
Thank
is
you
what
so
I
much.
have noticed.
Yes. I think these are some very important points that we all have agreed to and we all have noticed. और एक डॉक्टर शेखर ने बहुत अच्छी चीज़ बताई कि जिन लोगों को पहले हिस्ट्री रही है खांसी जुकाम की, एलर्जी की, अगर उनको होता है तो दैट इज स्टिल एक्सप्लेन्ड, कैन बी एक्सप्लेन्ड. बट दोज हु डोंट हैव एनी हिस्ट्री ऑफ एलर्जिक ब्रोंकाइटिस, राइनाइटिस, अगर उनको ऐसी प्रॉब्लम होती है तो दे शुड इमीडिएटली सस्पेक्ट दैट दे माइट बी हैविंग कोविड. और दूसरा ये है कि अगर आपको कोविड के कोई भी सिम्टम है, कोई भी लक्षण है, जिन सब की चर्चा की, सर्दी, जुकाम, खांसी, गले में खराश, पेट में दर्द, शरीर में दर्द, सर में दर्द, तो यू शुड ऑलवेज टेक इट वेरी सीरियसली. तुरंत अपना टेस्ट कराएं, बिकॉज दिस इज वेरी इन्फेक्शियस. आप हो सकता है बीमार हो और आप न चाहते हुए भी, न जानते हुए भी ये बीमारी दूसरे लोगों को फैलाएं. Now one question which is an open question to all of you: when to test and which test would you consider to be done first and subsequently? Because this is also a question that many it's not just that people feel that at times they test first, it is negative, then after 2-3 days it comes positive. So what is the ideal time of testing after onset of how many days of symptom, or if there's anything like that? Would any of you elaborate?
See, the incubation period of this virus is 2 to 11 days, and most of the time, like we had seen in last wave, the ideal time of testing was on 5th day of symptom onset. But then the replication rate of this particular strain is very high. I mean, it is 72 times higher than the traditional Delta plus variants. So what I'm noticing here is those patients who have even 1 or 2 days of history, if I advise them RT-PCR or that, they come out to be positive. So that is either because of very high uh, increase in number of infection, and another is that the virus replicates so fast that pickup rate is reasonably earlier we can pick up the infection. So rat is basically for screening purpose, that we can screen at emergency or before surgeries, and RT-PCR for confirmatory. So one thing is very clear, that any patient who if he has no history of any allergy or any cough, cold, sore throat, then the patient can be tested by rat, and any patient who has got influenza-like illness must be confirmed, even if rat is negative, must be confirmed with RT-PCR testing.
Okay,
I
thank you.
think importantly, we have to add the at-risk patients who have been exposed to a confirmed case of COVID. The at-risk, not everybody, but those who are high risk, as in the elderly or those with the comorbidities, they should get tested. But say again, about 3 to 5 days after they have been exposed to the particular confirmed case. Should get tested. It is also important to note that I think only yesterday, the recommendations for electively testing before surgery for anybody who's completely asymptomatic has been removed. And I think it is important for us to note that, because we did notice a lot of patients requiring movement to a COVID area because they were tested and found positive before they went for surgery when they had absolutely no symptoms at all. And I think this will change the number of admissions or the number of COVID movements that are happening in a hospital setting when we will electively not test everybody going for a surgery.
Yes, I think this is also important. Thank you for adding, ma'am. I'd like to ask from all of you, if anyone of you can contribute. Now, since there are both these options, the rapid antigen test, which can be easily done at home also, and the RT-PCR, for which obviously one has to call a technician who takes the sample, and it takes a little bit of time. So many people are preferring the rapid antigen test. So, but we know that it is almost, it has the probability of giving a right result, almost 50 to 60% of chance. So, how to interpret a positive and a negative rapid antigen test? When should repeat testing be done? So, anyone of you would like to elaborate on that?
So rapid antigen test basically is a kind of screening tool. I mean, it is very specific, although less sensitive. So if anyone who is rat positive, rapid antigen test positive is taken as positive, there is no need to repeat RT-PCR. And anyone who has got symptom of COVID, rat negative, we must repeat RT-PCR. RT-PCR is the only thing that can confirm. It also happened many a times that your patient has got a lot of symptom, RT-PCR and that both comes out to be negative. In those cases, we need to repeat RT-PCR testing after 3 to 5 days if the patient has any history of COVID-like illness.
Yeah,
Thank you
I
so much.
completely agree with Dr. Shekhar on this.
Yes, thank you. I think this is very important for people to understand that even if they test negative on this rapid antigen test, and if the symptoms pursue, then they need to be repeat tested, probably with an RT-PCR, to make sure that they actually are not missing out, that they are not in that 40 or 50% of the false negatives. Yes, thank you definitely so much about that. And Dr. Kavita, which patients you feel need to be more careful, the patients who are having some heart problems, which heart problem need to be more careful, and how and what should they be doing to prevent the complications of COVID if they contract that?
Especially the patients whose heart pumping is weak. They anyway are prone for lung congestion because of the heart. So in that case, if they get infected, because we are not knowing, the people, especially those who are not vaccinated, they are still have a chance to get Delta. So that will be a very serious thing for them. So people with the poor LV dysfunction, people who have undergone angioplasty, people who have some rhythm disorders like tachycardias or bradycardias, even they should be careful. But the people who have blood pressure, even we are seeing the fluctuations in blood pressure, so that they have to be careful. And in fact, all the patients, when we are seeing them, so we are telling them that along with your checking your saturation, you have to keep on checking your pulse rate, your blood pressure, and if you're diabetic, then blood sugar as well, very regularly. Unfortunately, in fact, today only I saw one prescription, still somebody was being given tablet Medrol. So that message also has to be given to the society that without checking inflammatory markers, which in this case of Omicron are not very common, inflammatory markers, especially most of the people are getting cured in the duration of 5 days. So steroids are not to be taken this time. Of course, last time was also it was a blunder for most of the people, but steroids are not to be taken like that. And antivirals are also to be taken only when symptoms are more than mild. That too with the consultation with the doctor.
Thank you. Thank you so much. Thank you. I think you have made some very important and very valid points that self-medication is not good, because a lot of medication which was being used during the previous waves of COVID may not be very helpful in this COVID variant. What is your opinion, Dr. Reshma, about the self-medication, about the Kada, and about all those multivitamins and zinc?
So I think one thing is reasonably clear to us that currently we are in the phase where we have Omicron, but we still continue to have a lot of Delta, which may or may not be detected depending on where the test is being done. While we have to be very cautious if a patient may be having Delta because he's more likely to become a severe patient, the Omicron, which is I think already reaching about 85% of the total COVID, is the one which is probably not going to end up, making you worse and taking you to a hospital. So self-medication is, I think, absolutely out of the scenario completely. No patient is advised to just even randomly take zinc or multivitamins, as had become quite a norm in the previous wave. When you are detected COVID positive, it is very important for every patient to connect with a medical personnel, and obviously the trained medical personnel for this, and only then he will be prescribed medication. For mild disease, we do not even need the antiviral or anything at all, and only from moderate disease onwards would you need a prescription or oxygen, etc. And as Dr. Kavita said, steroid is something, if we are largely looking at Omicron replacing Delta, should be completely left to the doctor to prescribe to you if and when you need it, when your disease becomes moderate, and self-medication with even vitamins to be kept out. As far as things like Kadha and all are concerned, I think, well, they may have some credit to the Ayurveda and other streams of medicine. So since they cause no harm, I would not say that a patient should not take it at all. But while they are taking that, they should not become complacent, that they do not need to take or seek the expert medical advice, so that they may be followed up appropriately and may be given the correct time when they may need to start medication or come to hospital, etc. That would be, I think, the most important they should remember.
Thank you. Thank you so much. I think you have made some very interesting and very important points. And obviously, if Kada gives you strength, and obviously it is so nice to have a warm flavored drink in these winters. So there's no harm probably in taking that. But one thing I have noticed that probably not all cases of COVID are Omicron. We should always keep our eyes open for patients who might be having the Delta variant, because in the past 1 week I already have seen 2 patients who are having severe respiratory distress and have symptoms of Delta and who had to be admitted and who are already in ICUs. So probably we have to keep a very watchful and vigilant eye open, because as of yet we don't have any specific test for Omicron, and otherwise we don't know who may have a problem with who may have a severe complication of corona. Text one question which is I think which all of us are getting from our patients, and which I'd like to ask Dr. Ravi is, Dr. Ravi, please tell us something about, हमें कुछ सरल शब्दों में ये CT वैल्यू के बारे में बताइए, क्योंकि जो मरीज की पॉजिटिव रिपोर्ट आती है सबसे पहले तो वो पॉजिटिव नहीं बताता, वो बोलता है कि मेरा तो 18 है, मेरा तो 24 आया है. अब initially I could not understand what that means, but please elaborate on it. What is the importance of that?
Right. So CT value basically जिस मशीन में हम टेस्ट करते हैं that is called cycle threshold value. Cycle threshold value का मतलब है जितना high viral load है, that is according to the normal kind of physiology उससे, जितना high viral load है इतनी कम cycle में that will pick up the RT-PCR the viral load. So lower the CT value, higher the viral load, but that is not always true. I have seen patient with CT value of say 27, 28 complicating into severe form. And I've seen patient of CT value of 10 to 12 और वो बहुत easily ठीक होके चले जाते हैं. So it can though indicate some viral load, but it is in no way related to prognosis of the patient. कई बार ऐसा नहीं है कि अगर हमारा CT value बहुत कम है, that means patient को complication develop होने का chance बहुत ज़्यादा है. Infectivity को हम correlate कर सकते हैं इससे, but outcome को, mortality को we cannot correlate with CT value.
थैंक यू सो मच. तो सरल शब्दों में CT वैल्यू पे आप ध्यान न दें. अगर आपकी रिपोर्ट पॉजिटिव है दैट मीन्स यू हैव कोविड, and if it is negative that means it is negative, and a positive report does not mean that you have Delta or you have Omicron. It can be any of the variants, because Delta is still circulating in the population. Approximately what percentage of patients COVID positive are having Delta still? Any idea to the panel? I mean, do you have any opinion about this?
Well, just as a thought, I think 25-30% patients are still Delta, I think. We do get reports where the S gene, depending on where they have got it done. So we are still seeing that. So I think about 20-30%. I don't know, Dr. Ravi, would you agree with me?
Yeah, absolutely agree. I mean, maybe slightly more, 30-35% kind of Delta variant is circulating still in the population, because, the data that was published few days back in few of newspaper, which established that around 80% of the circulating state is Omicron, but that was extrapolation to a very small number of samples that they have taken for genome sequencing. That is not the right way to do it, So still, I feel that all those patients who are presenting with hypoxia or severe illness, they have Delta variant. Like I was telling, 2 or 3 of my patients who have got significant hypoxia or admitted in hospital, they all come from the same family. That means they have got infection by the same strain. That means that they possibly are carrying Delta variant.
Thank you so much. Now one question, Dr. Kavita. A person develops all these mild symptoms, let's say, when is the time to go to the doctor? अगर किसी के घर में ये सब प्रॉब्लम किसी को हो जाए, सिम्टम हो जाए, तो डॉक्टर के पास कब जाना चाहिए? We can't hear you. I think you're muted, Dr. Kavita. Please unmute yourself.
Sorry. Yeah, so for simple symptoms like fever, headache, body ache, patient will require either tablet paracetamol or some painkiller if it is very bad pain, and for throat, etc. So these are medications, they have to be started by a doctor only. Other than that, people have to keep on monitoring their pulse rate, blood pressure, their sugars, their saturation level, because we are not doing genetic sequencing for majority of the patients. We are just assuming that the people who are vaccinated completely, they are maybe having the Omicron this time. That is one. But then there's some more entity that is Delta Cron. People are getting Delta as well as Omicron variant. So the only way out to understand that when patient is going to get sick is, I think, keep on monitoring the vitals, which are very much possible at home. for everybody, for all the patients nowadays, because everybody has a pulse oximeter, they have the glucometer, they have the BP instruments, so they can keep on measuring it. And the moment they get anything worsen out of them, they should contact the doctor immediately. And that is the clinical decision we give to our patients.
Okay.
I think importantly, we need to tell the people who are elderly and those with the comorbidities to connect faster, and we can give them the number of the saturation being 93 below as the time when they definitely need to seek medical attention. Ideally, even when they are in the mild course of the disease, they should be connected to a health attendant who can be maintaining a follow-up about their condition.
Yes, I think that is very important. All the patients who have the symptoms and who are positive, and especially those who have significant comorbidities, या तो एज ज़्यादा है, डायबिटीज़ अनकंट्रोल्ड है, किडनी की प्रॉब्लम है, हार्ट की प्रॉब्लम है, जैसे डॉक्टर कविता ने बताया, आप सब किसी डॉक्टर से कनेक्टेड रहें, चेक करते रहें और डॉक्टर को बताते रहें. अगर कोई भी प्रॉब्लम हो तो प्लीज़ कनेक्ट इमीडिएटली एंड गो टू हॉस्पिटल. Dr. Ravi, we have all heard about the 6-minute walk test. Please tell us कब करना चाहिए, क्या वैल्यूज होती हैं, कैसे करना चाहिए.
बेसिकली 6 मिनट वॉक टेस्ट का इम्पोर्टेंस ट्रेडिशनली हमारे पास इंटरस्टिशियल लंग डिजीज आईएलडी नाम की बीमारी होती है, वहां से स्टार्ट हुआ था. 6 मिनट वॉक टेस्ट का मतलब है 6 मिनट इज दैट टाइम जिसके अंदर की अगर किसी इंसान की सैचुरेशन सपोज 95% है और उनको लगता है कि उनके लंग्स इन्वॉल्व है, तो वी एडवाइज देम टू अंडरगो 6 मिनट वॉक टेस्ट. इफ दे वॉक फॉर 6 मिनट विद दैट मच अमाउंट ऑफ एक्सर्शन, उनकी ऑक्सीजन लेवल ड्रॉप होनी शुरू हो जाती है. Suppose if a normal person and a diseased person, they both walk for 6 minutes. जो normal person है उनकी saturation 95-96 से above ही रहेगी even after walking. If the saturation is falling below 93% after walking, that means your lungs are diseased. That means we need to evaluate faster. So कई बार ऐसा होता है कि patients have got very short window. मतलब we know that COVID pneumonia is also called happy hypoxic patients. The patient of COVID pneumonia called happy hypoxic. That means even if उनकी ऑक्सीजन लेवल लो होती है, they don't have developed too many symptoms. तो कई बार ऐसा होता है कि वो घर पे बैठे बैठे उनको लगता है कि सैचुरेशन लेवल नॉर्मल है, दैट मींस देयर लंग्स आर नॉट इन्फेक्टेड, पर द मोमेंट दे स्टार्ट वॉकिंग उनकी सैचुरेशन लेवल देखिए 88-89 तक ड्रॉप कर जाती है. दैट मींस कि लंग्स में ऑलरेडी इन्फेक्शन या डैमेज स्टार्ट हो चुका है. दैट ऑल्सो मींस कि उनको इमीडिएटली मेडिकल केयर की रिक्वायरमेंट है. एंड लाइक आई एग्री विद डॉक्टर रेखा कंप्लीटली दैट शी सेड कि हमें कोई भी पेशेंट को अनअटेंडेड नहीं छोड़ना चाहिए. लाइक माइल्ड डिजीज द डिजीज, जबकि हम सबसे पहले पेशेंट को असेस करके हम प्रेडिक्ट कर सकते हैं कि वो किस तरफ जा रहे हैं. दे कैन, इफ दे आर गोइंग टू काइंड ऑफ कंप्लीटली रिकवर और दे हैव दिस टेंडेंसी टू गोइंग इनटू सिवियर डिजीज. सो 6 मिनट वॉक टेस्ट हमेशा उन सब पेशेंट के लिए इंपॉर्टेंट है जो या तो माइल्ड केस में या मॉडरेट केस में है. अगर आपका बेस लाइन ही सैचुरेशन लेवल 90 के आसपास है तो 6 मिनट वॉक टेस्ट की कोई इंपॉर्टेंस नहीं है.
ओके, दिस इज वेरी इंपॉर्टेंट कि कुछ लोग जिनका वजन ज़्यादा होता है, जिनको कुछ बीमारियां होती हैं जैसे अस्थमा, COPD, और हो सकता है कुछ हार्ट की बीमारियां भी हों, जो स्नोरिंग करते हैं, उनका बेसलाइन जो ऑक्सीजन सैचुरेशन है वो अपने आप ही कम होता है. तो जब आप स्वस्थ हों तभी अपना ऑक्सीजन लेवल चेक करके देखें कि आपका बेसलाइन ऑक्सीजन कितना है, क्योंकि अक्सर ऐसा होता है कि कोविड होने के बाद जब लोग टेस्ट करते हैं तो वो कम होता है. तो वो जो शुरुआत था उससे कितना कम हुआ ये भी इम्पोर्टेंट है. इज इट सो और नॉट?
अगर कोविड में आपकी से ही सपोज 90 के अराउंड है, देन 6 मिनट वॉक टेस्ट की कोई इंपॉर्टेंस नहीं है, फिर हमें 6 मिनट वॉक टेस्ट नहीं करना चाहिए. हाँ, कोविड जब आपको हुआ उस टाइम अगर आपकी सैचुरेशन 95 थी तो आपने एट रेस्ट भी अपना सैचुरेशन चेक किया, एट 6 मिनट वॉक करने के बाद भी चेक किया. अगर ये 6 मिनट वॉक करने के बाद फॉल हो रही है मोर देन 4%, देन इट इज वेरी सिग्निफिकेंट. सेम वे अगर आपको प्री एग्जिस्टिंग सपोज आपको इंटरस्टिशियल लंग डिजीज है और आपकी सैचुरेशन पहले से 93 रहती है, रूटीन बिफोर कोविड 6 मिनट वॉक करने के बाद भी 93% रहती है, but now if it has started falling to more than 4% of your baseline, then it is important.
ओके, एक बात हमने पिछले बार ये देखी थी कि जो ज़्यादातर कोविड की कॉम्प्लिकेशन होती थी, they started happening during the phase of the recovery. जब बुखार उतरने लगता था ऑलमोस्ट एक हफ्ते बाद कॉम्प्लिकेशन ज़्यादा हो रही थी. So As of yet, I think we are less than 1 week into this sudden spurt of the cases of Omicron. So, what is your prediction? Is it possible? Because I'm sure you must be doing the inflammatory markers, CRP, and all those things. So, what is your opinion? Is it that in the coming few days there are going to be more hospitalizations and much more worsening of the symptoms, like it happened in the previous wave, or not? Because it is only 3-4 days, I think, maximum that we are into this major spurt.
Yes, so I feel I can foresee that we are going to see more number of severe cases over after a week or so, because the similar thing happened in last wave also. Initially, we were seeing very few number of cases, then number of cases had increased, then number of mild cases had increased, and then number of severe cases. So we had already seen a very high number of cases. Now mild cases have started coming to the hospital. Few of severe cases have also started coming. So if we do not, start taking COVID appropriate behavior routinely, then we might see very large number of sick cases in future, maybe around third week of January.
Okay, thank you, thank you. So we have to be very, very, very. And the question comes to you, Dr. Reshma, because you are an intensivist. How do you feel? How are we prepared? Are we prepared to deal with the next wave of hospitalizations if it ever is required?
Well, to some extent, we are in a better position than we were at the time of second wave. One being that a very large number of people are already double jabbed, and then there are a very large number where at least one dose of the vaccination has been received. The younger children have also started, the young adults, should I say, have started to receive their vaccination now. The healthcare workers per se are now vaccinated. And so unlike in the second wave where a lot of us had got sick, while we are having the same situation again, but they are all mild. By and large, we have not come across a healthcare worker who has had a severe disease so far, though the disease is too early for us to comment. I do think from that perspective, we are a little better, and therefore we may see more mild disease than severe. Other than that, I think the oxygen facilities in various hospitals, including government setups, have been jacked up, and most hospitals have set up their own plants to be able to cater to their situations and not face the situation that we did in the second wave. So there again, we have improved. And I think the ability to provide a bed to a patient who may need hospitalization is also better today than it was earlier. However, because we are expecting the number of patients infected to be maybe at the peak, it will probably be 3, 4, 5 times of what it was at the time of second wave, where we had a peak of at least about 4 lakh cases a day. Here it may be significantly more. And therefore, only time will tell how this jacked up facility may be able to help us. We are better prepared, but it's a new variant. It's a new time. So how we are going to behave is only something we'll all have to wait and see.
Thank you so much. Thank you. Yes, Dr. Vida, I'd like to ask you before you start speaking, because the cardiovascular diseases are the major cause of mortality now in our country and probably in most of the countries of the world. And somehow we are seeing that the major complications of COVID as of yet have been related to clotting, excessive clotting, and which ultimately lead to anyhow cardiovascular complications. So, what is your opinion? Are you going to see a surge in admissions, either because of complications of COVID per se, or because people with already severe morbidity, either diabetes or hypertension or heart failure, getting aggravated? What is your opinion, and how are you prepared, and how you think are the other hospitals of country prepared to meet this challenge? Because ultimately they're going to come to you and your fellow colleagues only.
Yeah, so as the peak comes, we are certainly expecting prothrombotic events, which can lead to clot in the lungs arteries or in the heart arteries, or for that matter, limb arteries as well. So we know how to deal with that. We have seen enough of that last time. Now, only one good thing I feel is, only it is my feeling, that people are very well aware of everything, because almost everybody has seen almost all the complications. So they report to you very quickly, actually. So that will help us, certainly. That will help the health system. Of course, all of us we are very better prepared. We have better oxygen, we have better beds now, more number of beds. As far as our Gangaram is concerned, so many beds are already full with the COVID patients. But yes, we have entire hospital, which we gave last time to the COVID patients. So we have plenty of infrastructure with us to deal with that.
Thank you. That is really, really very encouraging. Very encouraging. Thank you so much. Dr. Ravi, one very important pillar in prevention, I think, is the vaccination. And for people, for the special age group, for the elderly, and for those with significant comorbidities, probably booster is going to play a very vital role, as we understand that almost 66% of adults have already been vaccinated. So what is your opinion on that? Who should be taking the booster dose?
It is actually very right decision, right thing that has been rolled out. Booster dosing is basically mean for those who have already been vaccinated by double dose, or उसके बाद those who are more than 60 years of age and those who have got comorbidity. This is the population who have got higher chance of going into severe disease. So ये जो बूस्टर प्लानिंग स्टार्ट करी है, बूस्टर डोजिंग ने स्टार्ट की है, although हमारी कंट्री में थोड़ी सी लेट आई है बिकॉज what is normally seen is कि once आपको वैक्सीन लगती है उसके around 7 to 10 days के बाद you start developing antibody. बूस्टर डोजिंग में ऐसा नहीं होता. बूस्टर डोजिंग में you already have antibodies in your body and booster dose is given कि वो antibodies level थोड़े higher level तक sustain रहे for longer period of time. So all those who are elderly and have got comorbidity must take booster dose in right time.
Thank you so much. Thank you so much. Now, one more actual, a very realistic question that people are already asking me, and I'm seeing my patients facing at home. That is isolation. Now, we all know that a COVID positive person has to be isolated, and at times there are only 2 or 3 rooms in the house, and most of us are living in flats. They're not so spacious. So, what are the guidelines now for isolation? For how many days, and how to isolate a person in, let's say, in a 2-room flat, if there are 3 or 4 people living? Any recommendations or your opinions?
So there are 3 or 4 things that we need to consider always. First, all those who are positive can stay together. They need not be isolated from. A positive need not be isolated from a negative person. So अगर एक घर में सपोज हमारे पास 4 लोग हैं, 4 पॉजिटिव हैं, 1 नेगेटिव है, तो नेगेटिव सेपरेट रहेंगे, 4 पॉजिटिव एक साथ रह सकते हैं. अनदर इम्पॉर्टेंट थिंग इज कि पहले इट वाज इनिशियली जो सबसे पहले कोविड आया था तब 17 डेज का आइसोलेशन वाज रिकमेंडेड, which gradually reduced to 14 days. Or after a lot of research and study, we had seen that the maximum infectivity of virus remained for 7 days, or 10th day से infectivity becomes almost 0. So that is the reason कि अब जो हमारे पास आइसोलेशन क्राइटेरिया है, ये रीजॉइनिंग क्राइटेरिया, उसके अंदर मिनिस्ट्री ऑफ हेल्थ एंड फैमिली वेलफेयर ने रिकमेंड किया है कि आफ्टर 7 days ऑफ योर पॉजिटिव आरटीपीसीआर, सपोज आज किसी ने आरटीपीसीआर कराया, उसके 7 days के बाद आइसोलेशन पीरियड कैन बी ओवर एंड इट कैन बी रिलीज्ड. हाँ, ऑल दोज पीपल हु हैड सिवियर डिजीज, मतलब जिनका ऑक्सीजन लेवल डाउन हुआ था, we need to have their negative RT-PCR report before discharging them, but then severe disease do not stay at home. At home, only mild patients stay, or in some cases, moderate cases. So mild and moderate cases के अंदर 7 days of isolation nowadays is sufficient.
Yeah. Thank you so much. Thank you.
I would like to add 3 days of fever-free period. Yeah.
3 days of
being fever-free, no fever.
Okay.
Yeah,
okay.
afebrility.
Yes. Thank you so much. Thank you. That's very important. And now coming to building the immunity of our body. Now, Dr. Reshma, what is the role of yoga and pranayama in building immunity? Do you recommend would you recommend all of our listeners to start doing it from today itself if they were not doing?
Well, like I said again, I cannot speak like an expert in yoga on this matter. However, even at the time of the second wave, all patients who were connected with me and those even who are at home and, they just went through treatment for mild or moderate disease, we did suggest to them that pranayama and yoga, basic yoga, is perhaps the first form of exercise you should undertake. Because there were patients who were runners and marathoners and they wanted to just get back into their full fitness activity, that I am fine now. But what I suggested to them all was to take it easy for the first couple of weeks, then gradually add pranayam, and then step it up very, very slowly. I think yoga is a very beautiful form of, if we want to, in our discourse, limit it to exercise, I think it is perhaps the finest form that can be introduced to begin with. And then patients, when they continue to be experiencing no difficulty, they can then step up their exercise regimen to more. And for those of us who have not had COVID so far, maybe if we maintain pranayam and yoga for about 30 to 60 minutes every day, to whatever ability we can do it, I think if we do it now, it may benefit us through this pandemic.
Thank you so much. Thank you. And Dr. Kavita, how about physical activity, exercise? So, do you recommend people who are listening to exercise daily? Does that add on to their immunity, to their general immunity to ward off the infection or to fight it better? You are muted, man. Dr. Kavita, please unmute yourself.
So as Dr. Reshma mentioned about the yoga, so we do suggest our patients the pranayam, the meditation, the activity which makes you peaceful mind, because that always helps the people to control their blood pressure and heart rate in a better perspective. So that is always advisable if people can do it. Now, as far as exercise is concerned, so this will depend on what the baseline structure of the person is now. If they are sick now, obviously they cannot be asked to do the exercise. They will have to be initiated with the pranayam and yoga and whatever breathing exercises they can do, like fill in your lungs completely and exhale it out completely, whatever they can do. And yes, once they are over the disease, then they should start exercising. Exercise always helps blood pressure, sugar control, cholesterol.
Thank you so much. Thank you. Dr. Ravi, a question just came that, during the last variant of COVID, during the last wave, people were very frequently doing CT scans, that is to find the CT score. So when should ideally that be done, and are you recommending in this wave of COVID or not? Because at times people were completely asymptomatic, they were not having any problems, and the CT score would come to 18 or maybe a significantly high CT score.
I think CT scan is something that is hugely overrated in as far as COVID is concerned. I've seen that many people, they have this tendency to undergo CT scan on day 1 or 2 of illness. So what is when CT scan is required? That is a very good and important question indeed. CT, normally in COVID there are 2 phases are seen. First is multiplication phase, that means where the viral multiplier that remains for first week, and second where the maximum damage happens, that is on inflammatory phase. तो फर्स्ट वीक में देयर इज नो रोल ऑफ सीटी स्कैन. अगर आप करा भी लेते हैं, इवन इफ योर सीटी स्कैन स्कोर इज 5 और 6 या 20, इट डजंट मेक मच डिफरेंस. सेकंड वीक में सीटी स्कैन का इंपॉर्टेंस सिर्फ ये है कि आपको ये पता लग जाता है कि आपका सीटी सिविरिटी स्कोर कितना है. दैट कैन हेल्प यू इन काइंड ऑफ प्रोनोस्टिकेटिंग एंड मॉनिटरिंग योर पेशेंट लेटर. सो सपोज अगर 8 डे पे हमने किसी का सीटी स्कैन कराया है, सीटी स्कैन हैज सीटी सिविरिटी स्कोर ऑफ 20 out of 25, दैट मींस द पेशेंट इज गोइंग टू टेक स्लाइटली लॉन्गर कोर्स देन यूजुअल टू रिकवर, एंड पोस्ट कोविड फाइब्रोसिस होने के भी चांसेस थोड़े से ज़्यादा होते हैं. अगर आपने किसी पेशेंट का सीटी स्कैन 3rd डे पे करा लिया, उसका सीटी सिविरिटी स्कोर 3 या 4 आ रहा है, दैट डजंट मीन कि उनका सेकेंड वीक ऑफ कोर्स बिल्कुल नॉर्मल होगा. दे मे कॉम्प्लिकेट इवन ऑन डे 8 or 9. So first में CT scan बिल्कुल नहीं कराना चाहिए unless clinically indicated or patient has hypoxia. Second week में if your patient is developing hypoxia or any other cause of fever you want to rule out, then we should advise for CT scan.
Thank you so much. And one more trailing question to this. That is, we are all still under the impression that it was very difficult to find antiviral medicine. So many people are very anxious once they develop the symptoms and they report positive. They say कि डॉक्टर साहब अभी से ही फेविपिराविर या कोई ऐसी दवाई शुरू कर दो जो पिछले साल सब लोग ले रहे थे. So what is your opinion? Is there any role or need for starting antivirals? और अभी तो antibody cocktails भी आ गए हैं, and there's so much discussion, so almost everyone knows about it. तो पेशेंट खुद ये बोलते हैं, आपको ऐसा बोलते हैं क्या? एंड व्हाट डू यू डू, व्हाट डू यू सजेस्ट फॉर देम?
See, patients का pressure, it is very, very high during admission. Like I remember कि जब first और second wave आई थी, I was not very much supportive of plasma therapy. लेकिन maximum patients आके मुझसे कहते थे कि डॉक्टर साहब ने प्लाज्मा तो दिया ही नहीं इसीलिए ऑक्सीजन डाउन हो रही है. But I was not never in favor of plasma therapy, and eventually it was the guidelines for release की plasma therapy actually has no role. Then the same thing is true for favipiravir also. I was never in favor of that drug because हमारे पास कोई बहुत अच्छा rationale नहीं है, बहुत अच्छी evidence नहीं है उसके against में, उसके favor में. As compared to that, the molnupiravir we have significantly good amount of evidence, but the thing is that जो उसकी study है that is mostly unvaccinated people, and majority of Indian urban population is vaccinated. The another main the thing which is holding us back from prescribing molnupiravir is कि fertile age group के अंदर lot of teratogenicity risk is there. So I mean, I personally feel that unless we have proper consent form available, we have taken proper consent from the patient that it has got teratogenic potential, we should refrain from prescribing this drug, because majority of Omicron gets treated on its own self-limiting disease. So there is no point in loading up your patient with chemicals for a disease that can spontaneously recover. Now coming to cocktail therapy was basically made for Delta variant. It has no role for this Omicron variant, so that is that should not be prescribed in your patient. If the patient has got thing which is very suggestive of Omicron, if on genome sequencing you are confirmed that your patient has Delta variant, then of course this antibody therapy can be prescribed.
Thank you so much. And one more question to any of you who would like to take this is about pregnancy, because it is so widespread. So many pregnant ladies are also getting infected with either COVID, Omicron, or Delta. So how does it affect them? Does it affect the baby or the delivery?
The COVID or the medication?
COVID, not the medication.
Well, last year was a bad experience during the second wave with Delta variant. COVID and pregnancy was a disaster combination. And we did find that a lot of young women who came with pregnancy, and that too probably by the time they were 7, 8, 9 months pregnant, while we were able to save the babies by intervening at the right time for a cesarean section, etc., there was very high mortality among this set of patients. As far as Omicron is concerned, we need to yet see what happens. The disease so far, like we said, as far as Omicron is concerned, we are still seeing it to be largely mild. But we must keep our eyes open for the Delta also being there among this group, and following closely. The pregnant patient is a very, 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 very high risk patient from what my experience has been in the second wave, and we should continue to look at them in that way.
Thank you so much. Thank you so much. And since we are already running short of time, we have already overgone our time limit. I request each of you to give a short message for our audience. Let's start with you, Dr. Ishma.
Well, I think while we have spoken of all the negative things during this course of discussion, so I think the idea was to point out to everybody that we should not take it light and easy, and it is very important to maintain the COVID appropriate behavior with appropriate masking up, appropriate social distancing, getting ourselves vaccinated for those who have not, and for the third dose for those who need to, and follow that very strictly. But having said that, I think we must also not panic. And we must believe that our healthcare infrastructure, etc., has been boosted up, and we will see through this pandemic. I think better than probably the way we went through with the second wave.
Thank you so much. Thank you so much, Dr. Kavita. Would you like to give a message to the audience, to our listeners and viewers?
Yeah. So the all general measures, which all of us we know by now very well. Other than that, patients have to be especially precautious for their blood pressure, their heart rate, their saturations. They have to keep on taking their BP medications, and the people who have undergone angioplasty, their blood thinners and everything. So those medications have not to be stopped without consulting any doctor.
Very important, very important. Dr. Ravi, would you like to give a message to our audience?
Yeah, so basically, we all need to follow the COVID appropriate behavior and take complete set of vaccination and booster dosing. Besides, we should not fall for any rumors like पिछले कई दिनों से on you can see on all social media कि news is or forward is coming कि Omicron variant is very mild variant and ये अगर हमें लग जाता है तो we are immune forever. I mean, we should not take it in that way. हमें अपना precaution बिल्कुल completely लेते रहना चाहिए because we never know when this virus can mutate. So it is not necessary कि अगर infection फैला हुआ है तो हमें उसको लेना ही लेना है. There is no point in doing that. Please maintain distancing, mask and your appropriate behavior properly. Unnecessary आपको infection लेने की जरूरत नहीं है. Take properly appropriate things and vaccinate yourself.
थैंक यू सो मच सचमुच ये सब इतनी आसान और सरल चीज़ें हैं. मास्क पहनिए, डबल मास्क पहनिए और मास्क ऐसे पहनिए कि आपकी नाक बंद रहे बिकॉज मेजॉरिटी ऑफ पीपल वेयर मास्क ओनली बिलो द नोज. तो उसका कोई फ़ायदा नहीं है. हाथ धोइए, बार बार हाथ धोइए, हाथ को सैनिटाइज करिए. कुछ ये चीज़ें हैं जिनका ख्याल रख के आप अपने आप को बचा सकती हैं. और आपको अगर कोई भी बीमारी है, डायबिटीज़, ब्लड प्रेशर और किसी प्रकार की बीमारियां हैं, थायराइड की, डॉक्टर ने जो आपको दवा दी है वो खाते रहिए, उसको किसी भी हालत में बंद नहीं करना. और अगर आपको बीमारी हो भी जाए कोविड तो प्लीज़ कनेक्टेड रहिए, मॉनिटर करिए अपने आप को, किसी डॉक्टर से, हेल्थ केयर वर्कर से संबंध में रहिए, अपने ऑक्सीजन लेवल चेक करिए. बहुत सारी चीज़ें जैसे जो अभी सब ने बताई. So I'm so thankful to all of you for coming here. Now I'd request Shri Anil Rajput ji to give a vote of thanks and summarize. So over to you.
Thank you very much, Dr. Kesri. Before I start, I just want to ask one clarification. I think Dr. Tiwari had mentioned about it, but I just want to ask that question once again. If somebody has come in contact with somebody who is COVID positive, does he need to get isolated immediately?
Sir, as per the, the earlier guidelines were different, but now what they have changed in this aspect is that the person who has come in contact with a confirmed COVID positive patient need not immediately isolate himself. However, if he develops any symptoms, etc., that is the time when he needs to be tested and isolate himself. It is important that, however, wherever he may be moving out, etc., he should be properly masked up, wearing a mask, and going about with his activities with complete COVID active behavior.
And should he test after 3 days or 5 days to be sure?
Only if he gets any symptoms.
If there are no symptoms, there is no need to test.
There is no need for testing, sir.
But if there are some people who are hypersensitive, then when should they test?
Then they should get tested about 5 days after their exposure to the confirmed case, sir.
After 5 days, not 3 days.
3 to 5, you can say, sir.
I mean, if there are no symptoms, and after 3 days also, if they test, it will kind of give them mental peace.
If there are no symptoms, then I think maybe 5 days is a better option, sir.
Okay.
When there are.
Okay, thank you very much. It's an honor for me to actually thank all of you today after such an enriching discussion and clearing everybody's doubts. All those people who joined our webinar today must have enriched with the experience that Dr. Jha, Dr. Reshma Tiwari, and Dr. Kavita Tyagi has shared with us. All of them have put everything very simply for everybody's benefit. And the general message that everybody gave to the audience that virus is picking very fast, Dr. Jha said. Ideal time of testing is 5th day. People with symptom must be tested. They cannot take it lightly. Rat negative with symptoms should be tested for RT-PCR. CT value doubts have been cleared very well by all the panelists. And Dr. Jha talked about 6-minute walk test. So thank you very much, Dr. Jha, for your very valuable inputs. And the most important thing that he mentioned, that people should stay away from any rumors and especially from the WhatsApp university, because that does not help. If you have symptoms, go back to your doctor, get his advice, and take it forward the way it is required. Dr. Tiwari has talked about how yoga can help people. Pranayama was recommended even in the second wave, and nobody should take the current wave lightly. People should always follow COVID appropriate behavior. At the same time, she said that there is no need to panic. Healthcare system has been augmented, and the healthcare workers are ready to give their best in case any emergency arises. Although at the current moment, the current trends are not showing any sign of crisis, but Dr. Jha was very clear that even in the second wave, first few weeks did not create any panic, and it is only at a later part we saw a huge amount of crisis for the healthcare. Dr. Kavita also shared, people with heart problem, especially need to take extra precaution and care, and people should, the moment they have symptoms, need to go back to their doctors. Awareness level has increased during the last 2 years, and it is helping the healthcare system. General awareness level having improved, people need to still take a lot of precautions for their heart rate and saturation level. No medicine should be stopped by the people who have been taking whatever medicine have been prescribed to them. So I think several messages have been given to people, and I'm sure they have taken them well. And we are most grateful from ASSOCHAM for all of you coming and sharing your experience, thoughts with our esteemed members, and we will continue to rely on your support for our programs going forward. And I would also like to thank Dr. Kesri, who has been my partner for, I think, almost 3 years on several programs of illness to wellness. And we really value his partnership with us. Thank you very much, Dr. Kesri. Last but not least, thank you to the ASSOCHAM team, who works very hard to do several programs on important topics on illness to wellness. And I like to once again thank all of you. Thank you very much.
Thank you, sir. Jai Hind.
Thank you, sir. Thank you, everyone. Thank you, my co-panelists.
Thank you.